Hey everyone, it's Peggy Hasenauer here, Executive Director of the Kovler Diabetes Center. I'm thrilled and honored to have my friend and coworker and colleague, Rabia Ali, with us. Although, Rabia, you did just get married, so I certainly want you to share your new married name with us. And I would love for you to tell us a little bit about what you do at the Kovler Diabetes Center.
Definitely. Thanks for the great introduction, Peggy. My name is Rabia. I joined the University of Chicago about a year and a half ago. The reason I joined the University of Chicago is because of a personal reason. I have type 1 diabetes myself, and actually so does my husband. We got married it's going to be a year in June. It's been great. We're a good support for each other. And, I know with diabetes, there's a lot of support that's needed, either from family, from your healthcare providers. Just having a community and a group, I think, is really important. And it's been great working at Kovler. A lot of our research is geared towards type 1 and type 2 diabetes. So we're here for, the community, the UChicago community and the Chicagoland community in general. So thank you.
Great. Well, Rabia, you're so modest. I mean, you're a nurse with a master's degree who's also a certified diabetes educator. You came from a really prominent medical center in the Chicago area, and we were thrilled to have you join us as part of our clinical research team. So tell us about that. So, the last few years at Kovler, I think we've worked really hard as a team to help people understand what clinical research we do, what clinical research is, and why it's important. So as you mentioned, we do a little bit of each. So can you share with us a little bit about your role and why clinical research is important to people like you with type 1?
Definitely. So I think clinical research is super important. And to be quite honest, even myself, I wasn't that aware of all the great opportunities that are out there. One of the biggest trials that we do that I think is super amazing is the TrialNet study that's funded by the JDRF and NIDDK, which is the National Institute of Digestive and Diabetes Kidney Disease. So with that study, it's great because we can screen participants who have a relative with diabetes because they have a 15 times greater risk of developing diabetes. So what we can do is, they can come in for a blood draw, or we can send an at-home kit to them to do the blood draw at home.
Right.
And we test for autoantibodies to see if they're at risk for diabetes. So I think this is great because, it opens up opportunities into different trials that TrialNet has to prevent progression to type 1 diabetes. And I wish I knew about this option. Of course, when I was younger, I think it's great that TrialNet is doing this, and it's super important for people to know. So but being with Kovler, I think I've learned that clinical research is really important, not just to identify those who are at risk for certain diseases. It's also a great platform to introduce drugs to cure the disease as well. So another study that we're doing is the Protect Teplizumab study by our sponsor, Parexel. And with that trial, what we're doing is for kids ages 8 to 17 who've been diagnosed with type 1 diabetes within the last 6 weeks, we're trying to see if this drug, teplizumab, can preserve beta cells and decrease insulin need, and see if we can possibly, hopefully, cure diabetes. So
That's incredible. So tell us, if someone is not a patient of the University of Chicago, and say they live in South Bend, Indiana, for instance, or Milwaukee, Wisconsin, and they see this video and they think, I would love to participate in research at the university. Who do they contact? So how do they get in touch with you, Rabia, or our clinical research team?
yeah, definitely. So they can contact myself, Rabia Ali, or Gail Gannon, our clinical trials manager, and I can share that information as well. And basically, either we can hook you up with someone that's closer to you, or we do provide reimbursement for travel. So, when we do talk about clinical trials, we do provide education on time commitment, because some of these trials do require frequent visits. For some of these blood draws, either they're blood draws or they're infusions, it just depends. And we do, share that information, and then it's up to the, participant if they want to join the trial. And like I said, for example, for the teplizumab trial, we do provide reimbursement for lodging. We do provide reimbursement for travel. So there are, options out there, definitely, for, people who are a little bit further away from the University of Chicago, to make it
Right.
possible for them to do this.
Great. And we can send people to kovlerdiabetescenter.org. We can also have information about clinical trials there where you can find that. But then we can also share more about how to reach out to us on Facebook and Twitter and also Instagram. You can also email us, I think, at diabetes at UC hospitals, plural on the hospitals.edu. That's again, diabetes at UC as in Charlie, hospitals, plural on the hospitals.edu. And I can forward the information. So I personally, as you know, Rabia, check those emails directly, and I'm happy to forward them to you and Gail as we move forward. It's interesting. We're also in the process of expanding our team, as you know, and we will be sharing more about our team expansion, which not only includes, of course, Christy, who works with you, but a new nurse who's joining us in June named Colleen, that we're just thrilled to have her on board. So I think it would be cool to have all of you sort of talk about our work and the importance of it at U of C. If someone is interested in a particular study, you had mentioned one of the studies we are working on is for people with type 1 who are newly diagnosed. Tell us what the window is. So say I'm a mom living in the suburbs and I have a child with newly diagnosed type 1 diabetes age 15. Okay. How do we reach out to you, or how do we connect with you to learn a little bit more about trying to get involved in a clinical trial in that window?
Definitely. So I think, yeah, first I do want to share my email and my phone number. I think that's the best way to reach me. I do have a cell phone that I keep on me at all times. So my phone number is 773-225-4362. Again, that's 773-225-4362. And my email is rali7@uchicago.edu. And once you contact us, I think, the window is tight. So from the date of diagnosis with type 1 diabetes, we have 42 days to give the first dose of the infusion. So with this drug, teplizumab, there is a 12-day infusion at month 0, which is 42 days from diagnosis. And there's a second round of infusion that happens 6 months after that. So within those 42 days, it is critical because we also have to bring someone in for screening to see if they're eligible, if they meet the criteria. We do certain blood draws to check for HbA1c. We check for, other things to see if they're eligible. And then within that 42-day window, we have to bring them in for an infusion. So time is key. Time is critical. Of course, it is a lot of information for parents to absorb, and we totally understand that. We have great resources. As Peggy said, I'm a certified diabetes educator. We have our principal investigator, Dr. Lou Phillipson, and Gail Gannon, and we're all here to, not just answer questions about the trial, but to ease the burden, to see how we can help, cope with what's going on. And we're here to provide, we're here any time of the day to take a call, answer questions. There are a lot of questions about, like I said, time commitment, questions about possible side effects, questions about also diabetes itself. So, we're here to provide resources, but Peggy, like you said, the actual window is 42 days, and the first step is to get in contact with us. And I think even if someone is confused, like they don't know if they want to do the trial, what we suggest is at least coming in for a screening visit, even if they're thinking about it. The screening visit is about, I would say, 4 hours long. And just to do that, and they can still think about it, but just to get them in, because that clock is ticking, I think is really important. So that's what we like to tell our participants, that, at least do the screening and you can still think about it and back out if you want to.
How much screening can you do via telemedicine? So in this sort of strange shelter-in-place time frame that we're in, the best thing to do perhaps is for parents of children with type 1 newly diagnosed to contact you first, and then is it possible for us to do some of this screening without them physically having to come to the university? How is that changing in the context of COVID-19?
Yeah, so currently for the teplizumab trial, right now, recruitment, of course, we can't do the infusions. Almost all sites is not able to do the infusions. So what we're doing is we're still pre-screening participants. So
Great.
meaning that, we're making sure that there is an actual diagnosis of type 1 diabetes. We're looking at their glycemic control. We're still talking to them about time, time commitment, and we're providing all that information, and then, keeping them in the queue in case, whenever hopefully this is lifted, we can bring them in right away. So we are doing pre-screening as much as possible. Same thing for TrialNet. Right now, typically we can have participants come in for a blood draw at the University of Chicago, or we send them to Quest Labs. Since that is, we want the key is participant safety. So we
Sure.
exposure. So what we are doing is TrialNet is sending at-home kits. So, they can do the blood. It's a finger, a 10 to 15 drop, and they can mail it out to TrialNet directly for the lab to analyze that. And then we have another study down the pipeline that's actually coming up called Tolarian. This study is for type 1 diabetes that was diagnosed within the last 5 years. It's ages 18 to 30, it's 18 to 40 actually. Ages. So
18 to 40. Okay.
And it's within 5 years of diagnosis. So with that, like I said, we're already starting to pre-screen participants. If they're interested, reach out to us, let us know. As soon as this is lifted, hopefully very soon, we can bring them in for screening. For the Tolarian study, the time frame is more flexible because it's within 5 years of diagnosis.
Right.
So that's a great thing where we're able to pre-screen participants and see, if they meet some of the eligibility criteria to bring them in for screening once things get lifted. Yeah.
That's fantastic. I think what people probably need to know too, Rabia, I was thinking about this as you were talking. We're doing so many important things at Kovler. There are other institutions in Chicago that are doing some clinical research, but to my understanding, and I've been at this for many years in Chicago as you have, I haven't seen the breadth and the scope of clinical research studies at other institutions like I've seen it at our center. And it sounds like even for the type 2 population, we're really trying to help out people with type 2 diabetes. You're working with one of our doctors in primary care who we adore, and I would love for you to share a little bit more about that work that you're doing for not just the type 1 community, but individuals struggling with type 2.
Yeah, definitely. So I am working with Dr. Huang. He is amazing. The study is called the My Diabetes Goal Study. It's with older adults with type 2 diabetes. And basically, it's actually really amazing because this study was geared towards having participants set their own goals. So asking, giving them more autonomy on what do you want to achieve? What do you want to do? And the idea is to utilize the electronic health record and utilize my chart of, the way patients communicate with their doctors to fill out a survey. And then from there, I make monthly phone calls to these patients to see, where do they need help? What resources do they need? Getting information from them about low blood sugars, getting information from them about any medication barriers they may have. So I think it's really great because this research study, started before all of this happened, and it was all remote as it was. It's phone calls that we're doing. So I think it's great that we're able to continue that, 100%, because I'm still making those phone calls. It's really interesting for these participants to share their struggles and, what help they need and the fear around COVID. So it's nice to be able to give back to the community, educate them, educate, different participants on how to manage blood sugars during these times. There's some misconceptions about COVID, so making sure that you're directing them to the right resources, the American Diabetes Association. So they're very thankful for that.
That's great. Let's switch gears a little bit because I think you touched on an important point, which is, you sort of wear several hats at Kovler, which we all do. And I think that's what makes us so unique as a team, that you are doing a clinical research study, but in the process of that, you're actually educating patients. And so you're at home, you've shared with us, which is incredible, that you have type 1 diabetes yourself. What are you learning about yourself at home in terms of management? Or what are you sharing with patients over the phone who have type 2, who are like, I have had it, I don't know what to do with myself, I need resources? What are some things that you've learned along the way, or maybe some tips that you've shared with your own patients?
Yeah, so I think for myself, I like telling people living with diabetes is hard, and it's not perfect. it's never going to be perfect. You know, a lot of patients ask, how do you master it? How can you have a perfect HbA1c, which is a 3-month estimate of your blood sugars? How can you have the perfect, you know, time and range of blood sugars? And I tell them, you know, there's stages. It's not always perfect. There are times when, you know, you struggle. Blood sugars can be elevated during times of stress. That's happened to me. We're all stressed out right now. So finding ways to, you know, reel that in and see, look at the positives. And I've started meditating and doing yoga to help with the stress. A lot of my patients are saying, you know, every time they turn on the TV, they're always just hearing about the mortality rate with COVID, and nobody's really hearing about people, you know, patients that are being discharged. So, you know, telling them to focus on the positives. Take this time now, you know, you're at home, focus on yourself, see what kind of foods, you know, affect your blood sugars a certain way, write it down, make a diary, do a food diary. I know, like, usually in the regular day, it's hard to, you know, keep record of what's going on. So now is a great time, you know, keep a food diary, share it with your endocrinologist, see how they can help, and, you know, trying to figure out what's the best diet plan for you, you know, and like I said, meditation and yoga, just sitting in silence sometimes and listening to some music. So I think that's the biggest thing that I've learned about myself. You know, you never really know how things can, you know, affect your blood sugar. And I think it's interesting to see how that's, you know, happening. So
For some of us in this crisis, I think that we are learning, like you said, so much about ourselves in terms of how to take care of ourselves and one another. But we're also learning for us, for the first time, how to pay attention to what we're seeing, what we're feeling, because we don't have all the outside distractions. So I think you bring up a really valid point that if we take a few minutes to sort of focus on ourselves and what our needs are, perhaps that can go a long way. Rabia, you're a real star on our team. I tell you that all the time, and I mean it sincerely. I am so grateful that you joined us today. I think that people need to know that we have some real amazing experts on our team, but also who have really been on their own personal journey with diabetes. And that is the most powerful gift that you can bring to our patients and to all of us as your coworkers. So thanks again, Rabia, for joining us today. We will share more. Of course, as you know, I'll be working hard to try to text you and find you for a follow-up to this about some of our studies. So thanks again, Rabia, and any parting words for us?
Thank you guys. I mean, it's great working at Kovler. I'm so humbled to share my experiences and, you know, see how I can help others. And I think we're all here to just help each other and create a community. So I think, yeah, I'm blessed, and thank you guys so much.
Thank you, and have a great day, everybody. Rabia Ali and Peggy Hasenauer signing off. Take care.